Boils the size of apples, cities brought to their knees, and a virus that could make you bleed from your eyes. Today, we're breaking down 5 of the most deadly infectious diseases in human history, how they spread, how they kill, and what the medical world learned the hard way. All right, let's dive right in. Number 5, the Spanish flu of 1918, the pandemic that targeted the young. Life feels normal enough until a cough in the crowded barracks changes everything. The 1918 influenza pandemic was unlike any other typical flu season, citing 50+ million deaths. But what made it extra terrifying wasn't just the scale of people, but who it hit the hardest: healthy young adults in their 20s and 30s. Medically speaking, the Spanish flu often started as a fever and body aches, progressing to full viral pneumonia and acute respiratory distress. Patients could also turn cyanotic, where their skin and lips turned blue from the lack of oxygen, then ultimately drown in their own inflammatory lung fluid. Treatment options in 1918 were sadly more on the primitive side. No antivirals, no antibiotics for secondary bacterial pneumonia, no ventilators, care centered around rest, hydration, crude oxygen therapy, and nursing. And the Spanish flu's timing made it worse. The world was at war. Soldiers packed into trenches, troop ships, and barracks created perfect transmission highways. Cities that canceled parades and closed gathering places early had fewer deaths, proof that quiet, practical steps move the needle when there's no wonder drug to lean on. Cities hired health officers, reporting systems and labs popped up, hospitals got serious about infection control, and we learned basic things like opening windows, spreading out, staying homesick, and masking aren't glamorous, but they often work in helping slow the spread of infection. Number 4, smallpox. Humanity's oldest nemesis, caused by the variola virus, smallpox has haunted humanity for millennia. It usually started like the flu: fever, headache, body aches, and then the rash showed up. First tiny spots, then blisters, then deep pustules that covered the body. People who survived were often left with pitted scars, and some lost their sight. On average, about 3 out of 10 people who got it died. The variola virus didn't just sit on the skin. It spread through the blood, inflamed blood vessels, and hammered organs. Those famous skin lesions were like tiny virus factories, leaking fluid, inviting bacteria in, and setting people up for sepsis. Doctors back then didn't have a cure. Care was mostly to isolate the patient, give fluids, and hope their immune system was strong enough to pull through. In fact, the game changer wasn't a treatment per se, it was prevention. In 1796, Edward Jenner noticed milkmaids who caught cowpox, a mild cousin of the virus, didn't get smallpox. For that reason, he scratched a bit of cowpox into a boy's skin, and when smallpox came around, the boy was protected. That simple idea became the first vaccine, so to speak, a type of immunology before we had the word. It really was a grind to end smallpox. Find cases fast, isolate them, and protect the people around them over and over until the virus had nowhere left to go. That mix of boots on the ground surveillance, isolation, and ring vaccination is what finally closed the book on smallpox in the wild. Today, only a few variola samples remain locked away in high security labs. Number 3, tuberculosis, the slow burn that never left. Picture a disease that plays the long game. TB isn't a flash flood outbreak, it's a slow leak. You can breathe it in from someone's cough, and the bacteria, Mycobacterium tuberculosis, can hide quietly for years. When it wakes up and turns active, that's when people get the classic trio: cough that won't quit, night sweats, and weight loss, or the old school trifecta called consumption. TB sets up camp in your lungs, and your immune system tries to wall it off, building little fortresses called granulomas. Sometimes these walls hold, but sometimes they crumble and leave cavities in the lung. That's when a cough can launch billions of bacteria into the air. And TB doesn't always stay put. It can travel to the spine or lymph nodes and even the brain, where you can get TB meningitis. In the 1800s and early 1900s, TB was everywhere. Back then, treatment meant a sanatorium. Think of a hospital crossed with a long-term long-term rest home and told to do 3 things: breathe in fresh air, eat lots of good food, and of course, lots of rest. If you were to get TB now, how would we treat it? Well, TB is definitely stubborn, so 1 antibiotic isn't enough. We use a 4-drug combo for a long haul, think 6 months at minimum. You have to keep the pressure on until those last stragglers are gone. If you stop early, the tough ones survive and you've just trained drug-resistant TB, which is harder to cure and way more expensive. If all that sounds pretty unglamorous, that's kind of the point. TB has never been a dramatic, one-and-done movie cure. It's a grind. And the old romantic image of pale, delicate, and consumptive never matched reality. Behind that look were months of coughing, isolation, and a lot of stigma. Number 2, Black Death, aka bubonic plague, the pandemic that rewired Europe. Imagine a busy medieval port in 1347, sails on the horizon, cargo hitting the docks, rats running everywhere. Hidden in those fleas on those rats was a tiny little bacterium called Yersinia pestis, and once it landed, Europe changed forever. In just a few years, the Black Death tore through towns and countrysides, killing an estimated 25 to 50 million people in Europe. That's roughly 1/3 of everyone alive there at the time. And plague didn't look just one way. The most famous version you've probably heard of was the bubonic plague. Tender, swollen lymph nodes called buboes, ballooning in the groin, armpit, or neck, accompanied with high fever and overall weakness. Sometimes the infection skipped the detour and went straight into your bloodstream. This is what experts called septicemic plague, causing sudden bruising, bleeding under the skin, and shock. And the scariest form of all of them, pneumonic plague, when it hit the lungs directly. That lethal version could spread person to person by droplets, and it killed with brutal speed. What was going on inside the body? Put simply, biochemical chaos. The bacteria release toxins that drive runaway inflammation and mess with clotting. So tissues start to die. That's where the blackened fingers and toes come from. And medicine in the 1300s didn't have antibiotics, unfortunately. The treatments included herbs, bloodletting, and prayers. This plague didn't just disappear into legend. It still pops up in small pockets from time to time. Yes, even here in America. The difference now is we can actually treat it. If you catch it early, antibiotics like doxycycline or gentamicin work, and public health teams keep a very close eye on rodent and flea populations and jump on cases fast, which is why you rarely hear about it. How do you know the stories are real? The ground snitches. When archaeologists dig up medieval cemeteries, they find mass burial pits with bodies laid in layers. Towns were overwhelmed so fast they couldn't do normal funerals. In some places, 40 to 60% of people died. And now we can test the victim's teeth for ancient DNA. Over and over, the readouts say the same thing: Yersinia pestis. That's the lab receipt. Number 1, Ebola. Ebola doesn't knock. It kicks the door in and takes no prisoners. Ebola crashed onto the scene in 1976 near the Ebola River in today's DRC. Since then, different species have sparked outbreaks across Central and West Africa. The scary stat you've probably heard is in fact real. Depending on the strain and how quickly good care shows up, fatality rates range from about 25% to 90%. Crazy deadly. Think of Ebola as a wrecking crew for your blood vessels, lining, and immune system. First comes high fever and feeling wrecked. Then the GIs hit. Severe vomiting and diarrhea. You lose tons of fluids and electrolytes. Blood vessels get leaky. Clotting goes haywire and organs start to struggle. You catch Ebola through direct contact with the body fluids of someone who's already sick. And certain burial rituals without protection have driven spread in the past. In terms of treatment, for a long time, it was all about supportive care. IV fluids, electrolytes, oxygen, pain control. That alone saves lives when it's done early and well. The big upgrades lately? Monoclonal antibody meds that target the virus, and an Ebola vaccine used in ring vaccination. But if care is delayed or the system swamped, Ebola can still be very deadly and hit like a freight train. And not to throw one more wrinkle into the mix, but our vaccine and best meds are for the Zaire strain. When Sudan Ebola virus shows up, some of those tools don't apply. Bottom line, Ebola is the most terrifying because it moves fast and hits hard, but it's not totally unbeatable. With speed, clear communication, solid basic care, and smart vaccination, what looks like a wildfire can be turned into a controlled burn. Hopefully, I gave you a solid medical insight into 5 of history's deadliest infectious diseases, how they break the body, how we fought back, and how each one changed medicine. If this blew your mind, check out my videos on deadly foods and medieval medicine in this playlist right here. And don't forget to subscribe, turn on your bell notifications, and hit that like button for me. Thank you so much for watching, and stay healthy, my friends.